Hi everybody. For those who don't know me, I'm Gareth Lima. I'm a retina specialist and the site director for quality, safety, and experience for the Department of Ophthalmology at Mount Sinai Hospital. I just wanted to go through some of the safety measure recommendations that we developed on the COVID-19 ramp-up task force. Two basic principles that are extremely important as we start seeing patients again and begin to increase our volume are safety and communication. It really is going to take the efforts of everyone on our staff and faculty, including providers, technicians, nurses, and imaging staff and administrative staff, to really make sure that everything moves smoothly and we are able to provide optimal patient care that's safe and efficient. First, I wanted to go through attire post-COVID. Really we have already had protocols in place for this. There's a dress code, there are sort of a uniform and type of clothing that people wear depending on their job description. That really hasn't changed, and we didn't want to change it. But what we do want to make sure is that everybody feels safe coming to work. We recognize there are some concerns that people are worried about using public transportation and either bringing COVID into the hospital or taking COVID home with them after they go home at night. So we're recommending that every site have at least one place where any faculty, staff can change before and after the workday. This will allow people to bring their work clothes in so they can dress appropriately at work, but then also go home in clean clothes that are not contaminated. Personal protective equipment is obviously something that's very, very important to a lot of people, and we wanted to go over some guidelines and recommendations that we came up with. First and foremost, appropriate PPE should be worn at all relevant situations. First, regarding masks, all patients, staff, and faculty should be wearing masks at all times. At the very least, this should be an ear loop surgeon's mask. We are working on acquiring N95 or KN95 masks for all of our faculty and staff, although these may be only available per their availability from the hospital. As everybody knows, this is a time where PPE is needed in many different areas of clinical care, and so our resources may be limited. N95 masks can be reworn, and there are a few strategies for keeping them clean and reusing them. Generally, they can be reused for about a week or 5 to 10 uses. The ways to keep them clean are to let them dry out when they're not being worn. That can be done by hanging them from a hook on the wall, or keeping them in a paper bag labeled with your name, or also keeping in a plastic container to prevent contamination. All patients and visitors will be also required to wear masks. There is one thing to note: N95 masks that have a plastic valve should be covered with a surgeon's mask or replaced with a surgeon's mask. The reason for this is the N95 mask protects the wearer very well, but that valve allows for exhaled air to disseminate throughout the room, and so can contaminate the room. Gloves can be worn but are not essential. They do not replace hand hygiene, and that's very, very important. One risk with gloves is that while they're protecting your fingers, they can also contaminate other surfaces. So if gloves are worn, they can only be worn in the exam room in which they're placed, and we ask everyone to be very, very careful of contaminating other surfaces. For instance, if they're used when contacting the patient, they should be removed prior to touching other surfaces like the keyboard, the desk, handles, doorknobs, sinks, or things like that. Patients coming into the hospital or the clinic cannot wear gloves from the outside. At the door, they should be asked to remove them. They can be placed in their pocket if they want to keep them, but they should be using hand hygiene rather than wearing gloves for the same reasons as stated above. By clinical situation, patients and visitors should all be wearing a mask. Masks may be provided by the hospital for those who are not wearing one, or are wearing one that is not sufficient. Masks that are not sufficient would be those that are either soiled, damaged, or an N95 with a valve. The patients can cover their own masks with one of our own if they don't want to remove it. For patient care in asymptomatic patients, surgical mask or N95 is recommended, especially for clinical exams with the slit lamp. An N95 should be worn by any clinician doing that due to its better protective capacity for the clinician. Gloves, goggles, and gown or white coat can be worn per provider preference. We are encouraging a white coat that is laundered regularly to protect the provider's clothes. Patient care for asymptomatic or COVID positive patients would include an N95 or KN95 mask that must be worn. Gloves, disposable gown, disposable face shield, and or goggles must also be worn. All PPE must be removed and disposed of in the patient's room before leaving, and reusable equipment like goggles must be cleaned immediately after the encounter. Cleaning and disinfection of exam lanes. This is also another very important point for a couple of reasons. We want to make sure that all of our staff are safe throughout the day, seeing multiple different patients, and we also want to project to patients that we have a process for cleaning the rooms and that our chief concern is keeping them safe. We wanted a very simple but comprehensive process. So to clean the rooms, there are a number of disinfectant wipes that are being distributed throughout the clinics by the health system. These include peroxide wipes, Santa Claus, Cavi wipes, bleach wipes. They may change based on availability, but the contact time should be on the box. So I just recommend that you look at the contact time just for your own information. They are all under 4 minutes, and there should be sufficient time between cleaning and rooming the next patient that this will not be an issue. The surfaces to clean are the exam chair, the armrests, the desk counter, slit lamp, chin rest, handlebars, vertical posts, and joystick, the slit lamp platform, sink handles, doorknob handles, computer keyboard and mouse, exam instruments that contact the patient, including the occluder or near card that the patient may handle. We'd recommend that a list of these be posted so that technicians know what should be cleaned in between patients. We also recommend marking at the patient that the room is clean by a sign on the door or on the wall next to the door. This is also a very important point in terms of our communication between physicians and staff that the room needs to be cleaned, and also communicating to the patient that we have a robust process for disinfecting the exam room. A sign has been made and provided to the office managers. On one side, it has a magenta circle with a cross, with an X to indicate that the room needs to be cleaned. This should be flipped sometime after the patient enters the room. As you room the patient, please show them this sign. It should say clean or have a green circle indicating that has been disinfected. Please educate the patients, especially in the next few weeks, that this indicates that the room has been thoroughly disinfected for their safety. Once the patient is roomed, the sign can be flipped. The timing of the sign, of flipping of the sign, will be optimal at the end of the encounter, so that if the patient is roomed a series of times, they keep walking into a clean room. But of course, once the patient's entered, it's contaminated, and so if it facilitates communication among staff that the room has to be cleaned at the end of the encounter, it's certainly okay to flip the sign earlier. Again, the principles that we're exhibiting here are: one, safety for ourselves, all of our staff, and safety for the patient, and making sure that the patients know that we have robust processes in place to ensure their safety. At the end of the day, terminal room disinfection should be done for all exam rooms that were used. This would be indicated by the clean sign being placed back on the door. The surfaces to clean are similar to those in between patients, but include more complete cleaning of all knobs on diagnostic equipment, including indirect ophthalmoscopes, all the knobs on the drawers, and the metal ring for any non-contact diagnostic lenses. An important note when cleaning diagnostic lenses is that the disinfectant wipes can damage the glass, and so it should not be used to clean the lenses themselves. These don't contact the patient and so should not be contaminated. Our recommendations for visitor policies and exam room occupancy. All patients are only allowed one visitor in certain situations. These include pediatric patients and those with visual or mental disabilities that require a person to accompany them. There may be other situations that require patients to have a visitor come with them, and we'll make allowances on a case-by-case basis. This might include needing a driver or someone to help understand the medical information that's being discussed at the time of the appointment, things like that. But again, this will be assessed on a case-by-case basis. We do have an exam room occupancy recommendation of a maximum of 4 patients allowed in the room at one time. And these are very specific people, I'm sorry, not 4 patients, but 4 people being allowed in the room at one time. And these are very specific, the patient's visitor, if there is one, physician or provider, and then one assistant. This could be a resident, technical staff, or a nurse, or someone like that. Those are the things I wanted to go through just now. Please feel free to reach out to either myself or your clinic manager if there are any questions regarding these policies. Again, we want to just reinforce that it's going to take a lot of communication and coordinated efforts to make this ramp up as successful as possible and provide optimal care for our patients, and keeping each other and our patients safe. Thank you very much.